My name is Leroy Maupin. I'm a nurse practitioner student at Maryville University, and this is my advanced health assessment. My patient is Miss A.M. She's a 46-year-old female patient. General inspection, she is a well-groomed, well-dressed, 46-year-old female in no apparent distress. We have had her empty her bladder, and we have unclothed her and put her in a hospital gown. We have done her vitals prior to this, and all vitals are within normal limits. We have assessed her height and weight. Her height is 5'7", and her weight is 178 pounds. And we have done the Snell and vision chart, and she has 20/20 vision. We're going to begin this head-to-toe assessment with the head, Ms. A.M., and we're going to inspect the skin. The skin seems symmetrical, no blemishes noted. The eyes are symmetrical. The ears are even and symmetrical. The hair is full and thick, and the scalp is normal cephalic with no lumps, masses, or tenderness noted. Ms. A.M., we're going to test some fields here. Can I have you clench your teeth for me? Very good. Can you squeeze your eyes really tight? Very good. Can you wrinkle your forehead? Very good. And can you stick out your tongue for me? Very good. And puff out your cheeks. Very good. We have tested cranial nerve number 7, the facial nerve. We're going to do light touch sensation at this time. Can you close your eyes for me? Tell me if you feel me touching.
Touch, 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 touch.
Okay. Light sensation is correct. The cheeks and the chin and the forehead, and that tests trigeminal nerve. Now we're going to assess the eyes. The external exam notes that the eyelashes are full and thick, the eyebrows are full and thick and even. And run past the eyes. We're going to palpate the macromolar apparatus, and then no tenderness noted, no swelling noted. We have tested near vision, and it is long. We're going to test your pupil response at this time. Leroy Maupin, and then just look straight at me. Pupils react. They are 2+ and react appropriately. Okay. We're going to assess the 6 cardinal fields of gaze. Follow this pin without moving your head. Very good. Very good. Very good. The 6 cardinal fields are intact. We're going to check consensual response. Can you close this eye for me? Cover this eye. Very good. And uncover. Very good. Do the same on this side. Okay. Very good. The cover-uncover test is appropriate pupillary response. And we're going to use the almoscope, and we're going to look for red light reflex. We're going to inspect the sclera. It is white. The conjunctiva in both eyes are pink and moist. Okay, look straight ahead at me, please. And red light reflex is noted. Okay, no blemishes noted in that eye. And again, the red light reflex is noted, and no blemishes noted in that eye. Okay, and during all of the tests with the eyes, we have tested cranial nerves 2, 3, 4, and 6. Now we're going to move on to your ears, and again, the ears are evenly spaced, perfect alignment. We're going to palpate the auricles, no tenderness noted. We're going to do a whisper test, and if you will, cover this ear for me, and you repeat what I say.
Orange.
Okay, cover your other ear, and repeat what I say.
Blue.
Okay, very good. And she has passed the whisper test. And now we're going to check with the tuning fork. Okay. And Ms. A.M., I'm going to place this on the top of your head. What I want you to do is tell me if you hear this in one or both ears more or equally.
Both equal.
Okay. And now we're going to test random test. I want you to place air conduction, bone conduction. Tell me when it stops.
Stop.
And again, tell me when it stops. And you can't hear it.
Stop.
Okay. We're going to check the other side. Mastoid process.
Stop.
Okay, and again.
Stop.
Okay, very good. And we're going to use the otoscope. And and we're going to look in your ear canals, Mrs. AM. Okay, tell me if this hurts.
No.
Okay, we are going to look at the ear canal and the tympanic membrane, and the ear canal is clear with minimal wax buildup. The tympanic membrane is pearly gray. And we're going to do the same with this side. And again, does that hurt when I pull up on your ear?
No.
Okay. The ear canal is fairly clear with minimal wax buildup, and the tympanic membrane is pearly gray. Okay. All right. And that concludes the ear exam. Now we're going to move on to your nose, and the structure of your nose appears normal, cephalic. We're going to palpate the nose, no tenderness noted. And we're going to palpate the septum, appears to be midline. Okay. And patency of each nostril, I want you to breathe in. Very good. And breathe in. Very good. And we're going to look inside the nose. And moist, clear, nothing noted. Tubercles are normal. Okay. And now we're going to look into your mouth, Users AM. Okay. Inspect the mouth and the pharynx. Okay. Can you open your mouth? First off, the lips do appear normal, pink, moist, no cracking. Open your mouth for me. The tongue is midline and moist and pink. Raise your tongue up. Very good. The base of the tongue is moist, no knots or nodules noted. The soft and hard palates appear intact and normal. I do notice all of her teeth with appears to be 6 cavity fillings noted. Okay, and we're going to test her awe and gag reflex. Can you say, open your mouth, say awe?
Ah.
The uvula moves up correctly, and the tonsils appear non-inflamed. We're going to check your gag reflex. Okay, gag reflex is intact. The lower pharynx is clear without any problems. We have assessed cranial nerves 9, 10, and 12. Okay, and the odor of her breath is normal. I do smell a hint of cigarette smoke. Ms. AM, do you smoke?
Yes.
Okay. All right, so now we're going to move on to the neck, and the neck is symmetrical. The skin is intact without any blemishes. And the thyroid, we're going to palpate for your thyroid. Yeah, count how it is very minimal palpated on the thyroid. No JVD is noted. Okay, we're going to do what we call a range of motion, passive range of motion with your neck. Okay, what I want you to do is touch your chin to your cheek. Okay, chest, and then touch your ear to your shoulder, and do it again with the other side. Okay, and come back all the way back. Very good. And I want you to shrug your shoulders. Very good. Cranial nerve number 11 is intact. Now we're going to palpate the carotids. Okay. And it is strong, 3+, regular. And that is strong, 3+ regular. We're going to palpate the thyroid again. Okay. And we're going to assess your lymph nodes. We're going to start with the pre and post ocular lymph nodes, occipital lymph nodes, tonsillar lymph nodes, subdural, superfacial, superficial chains, posterior cervical, deep cervical, and no tenderness or swelling noted. This time we're going to auscultate your carotids. I'm going to turn your head this way, take a deep breath and hold it. Breathe. And again, turn this way, deep breath and hold it. Very good. Just breathe. Hold your breath. And we're going to also auscultate the thyroid. Okay. No buries noted. Okay. We're going to inspect your upper extremities. We're going to palpate. Muscle mass is good. Skin tone is good. Hair distribution is normal. Hands are clear, non-cracking. Nail beds are clean and dressed. Capillary refill is 3 seconds. Okay. We're going to assess your brachial pulse. Okay. And your radial pulse. Okay, 2 plus your brachial and your radial. Very good, equal and strong. Now, can you turn around for me and let's assess your back? Okay. Very good. And we're going to undo your down for this process of the assessment of your back and posterior chest. And we're going to inspect the skin. We do notice a few moles on the skin. Have you always had these? Any changes in your moles that you know of?
I've always had them, there's no changes.
Okay, thoracic configuration is normal. We're going to palpate. Okay, and everything is normal. And we're going to cuss the costal mutual angles. No pain. No pain. Okay, very good. Respirations appear to be 18 clear. We're going to palpate for expansion, taking a deep breath. Very good. Now we're going to test tactile firmness. Will you say 99 every time you feel my hands touch you?
99, 99, 99, 99.
Normal vibration noted. We're going to percuss. Noting appropriate thickening and dullness in the appropriate areas. Okay, raise your arms up. We're going to percuss the lateral walls. Okay. And we're going to percuss diaphragmatic excursion. Take a deep breath and hold it. Okay. Very good. Okay. Let your breath out, 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 and hold it. Don't breathe. Very good. And let's do diaphragmatic extrusion is about 4 centimeters. Very good. Now we're going to auscultate. Okay. Take a deep breath. Very good. Very good. Very good. Very good. Raise your arms up, and we'll do the lateral waltz. Deep breath. Very good. And again. Very good. Okay, you can turn around. Okay. And we are going to auscultate chest. Very good. Very good. Very good. Good. Very good. Okay. Respirations are 18 clear. Deep breath. And the inspection of the skin is symmetrical. Respirations are 18. And respiratory effort is non-labored. No pulsations or heaving noted. We're going to palpate the chest wall. No crepitus or thrills or heaves noted. Okay. We're going to palpate for the apical pulse. The apical impulse is present. Okay. We're going to, again, when you feel my hands touching you, we're going to check for your tactile firmness on the front. 99.
99, 99, 99,
Arms.
99.
Okay, very good. We're going to assess infraclavicular nodes and the axillary nodes. No swelling noted. Okay. And we're going to auscultate heart sounds. Okay, using the bell, we're going to assess the aortic, the pulmonic, those points, tricuspid, and the mitral. Okay, very good. No breeze or murmurs noted. Can I get you to lay down? We will begin the abdominal assessment. Okay. I'm going to raise your hand up so we can assess. Okay. We're going to check your abdomen, and we're going to inspect contour, and no pulsations noted, normal movement noted. Okay, very good. At this time, we are going to auscultate your breath sounds, or vowel sounds, excuse me, all four quadrants. Vowel sounds are equal and active. We're going to auscultate your aortic arteries, aorta, renal, iliac, and your femoral arteries. There is no bruise noted. Now we're going to percuss the abdomen, listening for tympani and dullness in the appropriate areas. Dullness to be heard over organs. Okay. Normal percussions. Okay. We're going to percuss the liver borders. Very good. Percuss the spleen for dullness, and it is there. And we're going to start with light palpation. Let me know if it's tender anywhere.
Okay.
And then we're going to move on to deep palpation. No masses felt. No tenderness noted. Okay. We're going to do the right costal margins for the liver. Okay. No tenderness noted. Okay. We're going to try to palpate the left costal margin for the spleen. And again, the spleen is not felt. Okay. We're going to do the left kidney, the right kidney. Okay. We're going to palpate for aortic pulsation. Now measures AM, can I get you to hold your head up? We're going to palpate abdominal muscles and good muscle tone noted. Okay, you can sit back up. Now we're going to move on to assessment of the lower extremities, the legs and the feet. The skin is white and appropriate. There is no hair noted as there is in most females in America. The muscle tone of the thighs and of the calves are strong and good. We're going to, and the temperature of the skin is warm, pink. Okay. We're going to palpate for popliteal pulse. Dorsalis pedis. And tibia. Pulses are present, about a 1 plus. Okay, and now we'll test for sensation. Okay, measures AM. Close your eyes and tell me if you can feel me touching.
Touch, 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 touch.
Very good. We are going to go ahead and test for 2-point discrimination at this time. I'm going to have sharp and dull. You tell me which one. Close your eyes, please.
Sharp, 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 soft, 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 sharp.
Okay.
Sharp, soft, sharp, soft, soft, sharp.
Okay. And we're going to finish completing our neuro exam. We have tested most cranial nerves, the smell, olfactory, and taste. We have not tested during this assessment. We have tested sensation and 2-point discrimination. We're going to assess musculoskeletal. We're going to test your reflexes, measures AM. And we will begin with the brachial reflexes. Just relax your arm for me. Thank you. Okay, very good. And again, just relax. Okay, very good. We're going to check your knees. Very good. Very good. Now, if you will, I'll have you stand up, and I want you to place your leg here, just like that, and let your foot down. And just try to relax. We're going to assess the Achilles. Okay, very good. Switch legs for me. And we will assess the Achilles. Very good. Stand up. And I'll have you just lean over for me. We're going to assess the spine curvature. The spine is midline. There is no kyphosis or scoliosis noted. Very good. Okay, you can turn around. Can you squat for me? Okay, she is squatted. You got to notice the little popping in the knees at that point. I want you to shrug your shoulders. Okay, very good. Hold your arms up for me. And I want you to push against me. Ooh, ooh, very good. Have a seat. Okay. Okay, and this concludes the advanced health assessment. The findings during this assessment, the only abnormal findings is the fact that she does have some crepitus noted in her right knee that she notes is also tender when climbing stairs. This concludes the assessment for Mrs. A.M. Again, my name is Leroy Maupin. I'm a nurse practitioner student from Maryville, and this is my advanced health assessment. Thank you.